in Trinidad and Tobago. We're bringing you live coverage on TTT, Talk City 91.1 FM, Sweet 100.1 FM, Next 99.1 FM, and on Facebook at TTT Live Online. We go now to the manager, Corporate Communications at the Ministry of Health, Candice Alcantara.
Thank you very much, Mr. Rasta, and good morning, everyone. I am delighted that you have decided to tune in to today's Ministry of Health virtual media conference, which updates the public on the Ministry's COVID-19 strategies. Sharing the latest COVID-19 updates with us today are Dr. Roshan Parashram, Chief Medical Officer, will present the clinical update, Dr. Hazel Othello, Director of Mental Health, and Mr. Damian Taylor, Regional Manager for the Department of Psychiatric and Mental Health Services at the Southwest Regional Health Authority. I am Candice Alcantara, Manager of Corporate Communication at the Ministry of Health, your moderator. And as you can tell, we will be focusing on mental health or behavioral health and wellness this morning. But we start off first with Dr. Parashram's clinical update.
Hi, good morning. Thanks, Ms. Alcantara. Morning to Dr. Othello and Mr. Taylor from Southwest Regional Health Authority, members of the media, members of the viewing and listening public. So the update clinically as of 4 p.m. on Sunday, 1st November 2020 is as follows. The total persons tested in the public sector, 33,118. Those tested in the private sector thus far, 20,301, giving us a total of 53,490 tests completed, with a total positive cases from March 12 to present, 5,704. Total recovered patients thus far stand at 4,763, with a total active caseload of 832. There has been 109 deaths over that period, with over the last 24 hours there has been an additional 12 positive cases. As it relates to hospital, we have 60 persons in various facilities, 31 persons in step-down facilities, 160 at quarantine sites, and in total, in terms of home isolation, we have 741. By way of details regarding the hospitals, the 60 persons are split between the Couva Hospital and Multi-Training Facility, where we have 43 persons, 3 in the ICU, 2 in the high dependency unit. Cora, there are 14 persons, and at Gustus Long, there's 1 individual. Scarborough Regional Hospital at the Fort, there are 2 persons. In our step-down or transition facilities, there are 31 persons, 18 at the Claxton Bay Correctional Facility, 12 at UWI Davie, and 1 in Tobago. As it relates to our quarantine sites, we have 160 persons split between the Chancellor Hotel, where we have 22, Cascadia Hotel 42, Regent Star 12, Paria Suite 68, and at UTT Valsine Campus, which is a new quarantine facility, there are 16 persons at this time. If I could go to my single slide for this morning. So as Ms. Alcantara would have alluded to, we are dealing with mental health across the spectrum. So this graphic depicts disasters as they follow a predictable psychological pattern. It's a document from Johns Hopkins Medicine, Phases of a Psychological Response to a Disaster. So if you look at the left, I know it's a little bit off focus. We are seeing the top part of the left-hand column gives emotional highs. If you go on the bottom part, it says emotional lows. It takes you through a number of phases. So impact, it can be for any disaster. It can be for hurricanes, it can be for earthquakes, it can be for epidemiological disasters, as we are seeing in the pandemic. So basically, if you start on the left-hand side, you see the impact of the disaster as the first phase, and the writing on the bottom part of it are the typical types of behavior that you see in each phase of the disaster as you proceed through the disaster, from impact to restoration. So if we start at the impact phase, we're looking at persons generally have panic, confusion, disbelief, self-preservation, and family preservation. We go into a second phase, which usually comes right after impact, where it is called the heroic phase. In this phase, we have high levels of activity, altruism, rescue behavior, impaired risk assessment. So we quickly go into the other phase, which is something that has been called a honeymoon phase. It is the hallmark of which is community cohesion, and you have group bonding, optimism for normality, and relationship building during that phase. The fourth phase is a phase called delusionment. It is the longest lasting phase, usually in most cases, and its hallmark are community stress and fatigue. And I think coming out of this particular phase, Dr. Otello's combating pandemic fatigue will come out of it, and she will go into a little more detail. But just some typical types of behaviors: realization of limits of assistance, discouragement, physical exhaustion, maladaptive coping reactions, perceived gap between needs and assistance, and feelings of abandonment. We work past the delusionment phase, we go into the restoration phase. So restoration is broken into three parts. So we have working through grief, we have adjusting, and then we have rebuilding. So generally in the world, I think now we're somewhere at the delusionment phase. We need to put measures in place, both at the individual level and at the population level, which will help us all get to the restoration phase as quickly as we can. So Dr. Otello and Mr. Taylor will speak to specific measures. We are, in terms of the restoration phase, generally what we have is feelings of recovery, rebuilding, readjustment, grieving. An emotional first aid may be needed in the anniversary phase. The anniversary phase is generally some event that looks at the impact, usually an annual calendar event that will show you when you had the impact, maybe a year later, 2 years later. When we had 9/11, everyone feels the impact of that on that particular date. So those are anniversary dates. You need some counseling thereafter. Generally speaking, as you work your way through any disaster, you need to have different coping strategies, and Dr. Otello will go into a little more detail. Ms. Alcantara, that's my clinical update for this morning.
Thank you very much, CMO. And as mentioned by CMO, we move directly into a presentation from Dr. Othello on combating pandemic fatigue.
Good morning, Dr. Parasram, Ms. Alcantara, Mr. Taylor, media personnel, listening and viewing public. Today I want to talk to you about pandemic fatigue, what it is, how it affects us, the dangers of not addressing it, and how we can overcome it. The term pandemic fatigue basically refers to a feeling of exhaustion from the effects of the COVID-19 pandemic on your life. In other words, you're tired of it, you're fed up with the restrictions, you're fed up with the precautions, you just want your life to be back to what it was before all of this started. Pandemic fatigue is a very real entity, and in recent months, more and more populations have been trying to come to grips with it and trying to find ways of dealing with it. I'm sure we're all aware by now of the various ways in which our individual lives, livelihoods, family dynamics, employment opportunities, and many of the things have been affected by the pandemic. And this has happened globally as well as locally. We've talked on many occasions about the mental health impact on the pandemic, as we are doing today. As I've said on numerous occasions, it's perfectly normal to feel tired, to feel a bit burnt out, to feel a bit sad or anxious, even a little angry at times, to experience some grief, or to feel lonely or frustrated as a result of how the pandemic is directly affecting you or the persons in your social circle or in your family circle. However, if you're battling emotions, particularly intense emotions, every single day, it can become very exhausting. It can drain your energy, and it can result in an inner weariness, feelings of helplessness, and even feelings of hopelessness. What is now emerging after several months of dealing with the realities of this pandemic is a growing frustration, which leads persons to become demotivated about following recommended behaviors that can prevent them from contracting the virus and can protect others. So that loss of motivation clearly can lead to self-destructive behavior and behavior that can potentially harm others. This was illustrated quite recently, just 2 days ago, by an article in the newspaper, in one of our local newspapers. There was a photograph of a blackboard just outside of a local bar with a sign on it written in chalk, Better to die with a bear in your hand than a needle in your arm. Since we are all going to die anyway, open up the bars now. We shouldn't be dismissive of such opinions because they really reflect how people are feeling. And we can't tell people how to feel. We can't be angry with them for feeling differently from the way other people feel. And we certainly can't legislate or prescribe people's feelings. However, we can choose to remember that the bear in my hand can result in a ventilator or even a casket for someone that I love. Over the past months, it's become increasingly important to find effective ways to tackle this fatigue and reinvigorate public vigilance. This is by no means an easy task, but your Ministry of Health will remain committed to this effort throughout the duration of this pandemic. Can I have the first slide, please? Thank you. This diagram, which takes the shape of a pyramid, demonstrates the optimal way that mental health services should be provided in any population. Unfortunately, the writing is a little blurred and we apologize for that, but I will take you through it. At the bottom of the pyramid, you see what we call informal services, self-care and community care. These are the most frequently needed types of services, and they play a critical role in protecting and preventing persons with regard to the later development of mental health disorders, or if you already have a disorder, experiencing a relapse of your symptoms. So it's very important. That's why we keep talking about tips and providing you with guidelines so that you can care for yourself and so that you can assist in caring for those around you. The next level is what we call primary health care in medicine, which refers to the level of care that you receive at your local health center, your general practitioner, your private family physician, whoever you go to first when you think you have a medical situation. And at that level, some mental health screening, treatment of mild conditions, and at times referrals do occur in our current scenario. These referrals, when necessary, are made to the next level of care, which involves community mental health services and psychiatric wards in general hospitals. In other words, the clinics that mental health services provide in various communities and the psychiatric wards at the hospitals. And of course, when these services do not adequately provide what persons may need, only then do they have to go to the other level, which is admission to a psychiatric hospital. By now, I'm sure many of you are wondering, what does a pyramid about levels of care have to do with pandemic fatigue? Well, I shared that pyramid in order to emphasize what I've been saying from the beginning of the pandemic about the importance of self-care and community care. They're at the bottom of the pyramid because the largest numbers of people need these services. In terms of cost, they can be provided at much lower cost than the more high-level services, and they produce tremendous benefit. So, in that vein, I'm now going to provide some self-care tips which can help you manage pandemic fatigue and help you to motivate yourself to behave in ways that can keep you safe and protect others. First, as I've said several times before, keep your body healthy. Try to get enough sleep, eat properly, eat nutritious meals, get regular exercise. Also, limit your exposure to news. Sometimes it's just too much and you need to just take a break from it. I know you need to keep yourself informed, but do it at in a paced manner and rely on dependable sources of information. Engage in activities which help to relieve stress, and these include things like long walks, gardening, breathing exercises. Relaxation apps are particularly helpful, especially for the young people who love using their devices. You could also watch television comedies and game shows. In other words, television shows that don't increase your anxiety level. If you're feeling anxious, that's not the time to watch a murder mystery. And of course, there are other enjoyable things you can do, such as trying out new recipes and other hobbies. Remember that physical distancing does not mean the same thing as social distancing. In other words, you can safely maintain your social connections through the use of your cell phone, your house phone, your digital devices. You can do video calling. Use all these strategies in order to maintain your social connections. And that will become particularly important as we navigate our way through the upcoming holidays. Don't try to hide your feelings. Allow yourself to experience your emotions without feeling ashamed of them or feeling guilty. However, acknowledge them, talk to someone you trust about them, and sometimes keeping a journal can be particularly helpful. It's important to talk to yourself in positive ways. When we're anxious, we think about the worst possible scenarios happening. Our mind takes us through event after event. It hasn't happened yet, but we're thinking, what if this happens? And then if this happens, it might lead to this, and that might lead to this. And the next thing we know, we're in a cycle of potential adverse incidents, and we're becoming increasingly more anxious. And it becomes a vicious cycle. And if it's not interrupted, if you don't interrupt that cycle, it can contribute to experiencing symptoms of a mental health disorder. In other words, we need you to try to recognize negative thoughts when they occur. And when you recognize thoughts that are taking you in that direction towards feeling anxious, try to redirect your thoughts towards more positive things. For example, you could replace thoughts about, suppose I catch COVID, with thoughts about what are the things I have been doing. I have been acting responsible. I have been protecting myself. I have been protecting others. And reassure yourself by focusing on those more positive thoughts. The other bit of advice I would like to put out there is try safe new experiences. You can create new traditions with your friends or your family members, such as having periodic Zoom lines with family. People have been having family reunions with relatives abroad via digital platforms such as Zoom. Another thing you can do is perhaps, plan a weekend picnic with your family members, the people who live in your household. You don't have to invite anybody else over. Prepare something nice, sit out in your yard, and, play some music, have some fun, play some games, whatever your family enjoys. In other words, create new family traditions or new traditions with your friends, and you may find that you begin to look forward to these things and they take your mind off the adverse things that you were previously thinking about. In addition, after the pandemic is over, you may find that you want to continue these activities, and they may continue to add value and add enjoyment to your life. We know that no single activity or no single service can meet all your mental health needs, and therefore the mental health and psychosocial support network that I spoke about in an earlier press release, the technical working group for that network continues to meet regularly so that we can discuss and bring each other up to date on what services are being provided, so that we can track those services, and so that we can identify gaps that either an existing service might fill or some new service might be able to fill. The next few slides that I will show you will demonstrate the services that we are providing at the Regional Health Authority. So we go to the first one, which unfortunately is also a bit blurred, but this one shows you services provided by the Northwest Regional Health Authority, all the different clinics in the different areas. It tells you their location, their phone numbers, and what services they provide. So we can quickly go through them. The next one, please. Thank you. So this one is North Central, and it does the same thing. So we could quickly go on to the next one, which is the Eastern Regional Health Authority, and the next one would be the Southwest Regional Health Authority, and the last one that we'll show you at this time is the Tobago Regional Health Authority. So this directory has already been prepared. It exists. You can access it quite easily. If you want to access it, you can either call the mental health unit in the Ministry of Health, or you can send an email to mentalhealth.gov.tt, or you can contact one of the Regional Health Authority mental health services, and we can provide you with that information so that you, your friends, your family members would know where our services are located and how you can access those services. Can I have the last slide, please? Remember that as difficult as these times are, and although the pandemic will define how you conduct many areas of your life in the foreseeable future, it won't last forever. We must do everything possible to survive it in order to enjoy the wonderful things that life has in store for us after the COVID-19 pandemic. We must address and effectively manage pandemic fatigue in order to remain safe, keep our loved ones safe, and keep other persons' loved ones safe. So thank you for listening, and best wishes as we continue to navigate this journey together. Thank you.
Thank you very much, Dr. Othello, for those wonderful ideas, very simple things that we can do to cope and continue to find joy at this time. And we go now to Mr. Taylor, who will advise us of some of the mental health and wellness initiatives at the Southwest Regional Health Authority that are available for all of us.
Good morning, and thank you very much. Firstly, I'd just like to reiterate that the most important aspects that we look at is self-care, and that is really something that we have to instill in everybody in Trinidad and Tobago, is that we engage in self-care and utilize those informal networks. And so in terms of that, what we've been doing at the Southwest Regional Health Authority throughout the period, and the staff have been working extremely hard, and we have to thank them for that, is we've been delivering essentially four key aspects that we are doing right now and we're going to continue to do. And these are the things I wanted to mention to you today. So the first part is that we are continuing to deliver our services as they were prior to and throughout the COVID period. Obviously, we've had to move more into to providing telemental health services in our outpatient clinics. So it's our 9 outpatient clinics and our 3 specialist services. We are still providing inpatient services on Ward 1 and liaison services at San Fernando General Hospital, as well as providing care for our residents at the 2 extended care centres in Point Fortin and Couva, and the New Horizons facility in Paparo. In terms of the next aspect that we are providing, we're providing mental health support for the COVID parallel services within the Southwest region. So firstly, we're providing telemental health support to the Couva Home of Football, the Debe Yui sites, and the Augustus Long Hospital, and that's both for patients and staff. And in terms of persons that are in quarantine or self-isolation and might be under the surveillance teams, so that's the Caroni South surveillance team, the St. Patrick and Victoria surveillance teams, we're providing telemental health support there. And what I'd like to reiterate for those persons that might be in self-isolation or quarantine, if you are having concerns or you're not coping very well, please let the services know, because they have a direct referral route to us. The third aspect that we've been doing and we're looking to push really hard on moving forward is health promotion and education. And I think this links in really well with what Dr. Othello was talking about in terms of self-care, coping and managing. And what we want to do moving forward is to press forward, provide more information, more understanding in relation to mental health, because mental health is everybody's business. Everybody has mental health, and it's really important that we understand that and we get support for that. So we will be utilizing our media platforms, utilizing all of our health centers, our services, our clinics to provide information in relation to mental health and well-being. And you can also contact us at our facilities for that. In terms of collaboration, we are collaborating with key stakeholders internally with the Southwest Regional Health Authority and also externally with other ministries, NGOs, FBOs, because like I said, mental health is everybody's business, and it's really important that we support all in this endeavour. And in terms of accessing services, I think this is something that we really want to push hard and have people understand. I know Dr. Othello just mentioned the directory of services. In terms of accessing services in the South, you're able to use those. But what we also do is is we encourage that self-care aspect again. So everybody needs to be caring for themselves and utilizing those informal community care networks that they have, your friends, your family, your faith and religious organizations, these sorts of things. But on top of that, if people aren't managing, it's really important to have a conversation. And this is something that we stress a lot. Have a conversation with somebody. Just ask somebody, are you okay? Because that question alone can do wonders for somebody. If you feel like you're not coping or a loved one's not coping well enough and they're not getting the support within those informal community settings, you can always seek support through the primary healthcare centres, and the staff there will be able to ascertain whether or not you need referral onto specialist mental health services. And again, I would refer back to the pyramid of services that Dr. Othello was talking about. And then you can also access our services directly through that through the directory, but also by calling the SWARA hotline number, and they'll be able to direct you to their services, and that's 87 SWARA. So that's 877-9742. So I'll repeat that one more time. That's 877-9742. And if it is an emergency, again, you can go through the accident and emergency departments where our liaison team will be able to assist in those endeavours. And I just want to finish up by saying that everybody, it's our responsibility collectively and individually to look after our mental health and those of our loved ones, particularly those that might be at a higher risk during these periods. So older adults, younger children, and those sort of things. And that's where I will leave it for today. Thank you very much.
Thank you very much, Mr. Taylor. Very simple advice, but very important advice. Ask a question. How are you doing? Sometimes we ask that in passing, but let's really ask and really wait on an answer, especially these days. How are you doing? And we go into the question and answer segment. We ask members of the media, begin by stating your name and the media house that you represent before asking your question. And the panelists are all ready to field questions. Remember, we are focusing on mental health today, but of course we know there may be questions outside of this topic. And we go now to CNC3 from Guardian Media Limited, please.
Hi, morning everyone. Rashad Khan, Guardian Media Limited. CMO, I have two questions for you, but I'd like to pose them one at a time if possible in case I have any follow-ups.
Okay.
So my first question is, what is the protocol to be followed, or what is our stance, or how do we treat with suspected COVID-19 reinfection?
Okay. So basically what you have for a reinfected person is that individual would have been cleared of a virus. So as we discussed in previous press conferences, you have to make sure the person is cleared. So meaning that they have met the discharge criteria, gone beyond that, and there's some reason to believe that they have renewed symptoms in most instances, and then of course they test positive again. The being able to tell whether it is a reinfection at this point in Trinidad and Tobago may not be possible in terms of testing. As we have said a few times before, the University of the West Indies is trying to do some typing of the various types of the virus that we have. When they are able to do that, and we are able to do it in real time, we will be in a better position to see if there's possible reinfection. I think we are too early in the trajectory of the virus to determine whether you can be reinfected with the same strain twice. What we have seen, as I said before, is that we had clearance of the virus meeting the discharge criteria, and we had persons showing positivity long after, sometimes a month after, 2 months after, a couple of weeks after. So we had instances of that. We are tending to believe that in those cases, you would have had late viral shedding rather than anything else, or reactivation to some extent. But again, in the world, we have seen cases of reinfection occurring, even resulting in death. So we are not at a stage, I think, beyond using our clinical determination as to whether we have reinfection. So it will be classified as possible reinfection or reactivation, or just a latent sort of maybe reactivation based on your immune status at that particular time. So yeah, not a straightforward answer, but it is something that we are looking to build capacity into. We can send samples away to CDC at this point, but again, it will take quite some time to get back results of those individual samples.
Thank you, Mr. Khan. And your second question, please.
Okay, so how long would it take for the UV to be able to make that determination, like you said, that it needs to be done for that to be made?
So what they're doing now is a retrospective study, taking samples of persons that would have been positive, not only from Trinidad, but from other parts of the Caribbean, testing to see what subtypes are circulating. So they're not doing real-time testing of individuals at this point. They didn't start as yet. They had given me an update a couple of weeks ago indicating that they're looking forward to starting possibly later this month, but all things being equal, that is determined by the University of the West Indies. So we'll look forward to them letting us know when they can start. But when that happens, I think they are looking at retrospective studies in the first instance to see what we have, and then they can go to more real-time work once they cross that first phase.
Thank you very much, CMO. And we go now to 98.1 FM, please.
A very good morning to you, Ms. Alcantara, and CMO, the members of the panel. Stephen Cummings, 98.1 FM. I'll go quickly with my two questions, one for Dr. Thallo and the other for Dr. Parasuram. Dr. Thallo, mental health could very well be the next undisputable emerging health crisis, and it comes against the call for increased investment. How much of a role do you see corporate Trinidad and Tobago and indeed the private sector playing in this effort in treating with mental health disorders? And Dr. Parasuram, on the issue of presumed occupational exposure, how would you assess the level of safety now when it comes to healthcare workers themselves? Would you or would you not say that our HCWs are safer now that, now given that we know more now about the virus than we knew, let's say, 9 months ago? Thank you.
This question, where is coming out from?
Okay, good morning again, Mr. Cummings. With respect to corporate Trinidad and Tobago, there are things that they can do in order to contribute. The most important thing that they can do within their various organizations or companies is to ensure that there are healthy workspaces from a mental health point of view. In other words, ensure that persons feel supported and valued within the organization, that concerns and complaints are heard, and people don't feel stigmatized or victimized if they have a mental health disorder, that they have access to care when they need it, and so on, so that things like stigma and discrimination don't become impediments to persons within your organization seeking their help when they need it and accessing re-entry into the workspace when they're well enough to continue work. One of the other things that is important that we haven't talked about too much yet is the whole issue of supported employment. Because, for instance, a number of persons who experience mental health disorders, at the time of the illness, they may be unable to work, but after they've been treated and gone through rehabilitation when necessary, they may be more than able to go back into the workspace, but find it difficult to do that because nobody wants to hire them, even though they're competent to do a job that they've been perhaps trained to do, or they're in a place where they can be trained in an on-the-job training type program, so that we encourage employers to be receptive. In other words, if the person has a report from a medical practitioner or from a mental health specialist saying that they're well enough to work, you shouldn't feel afraid to employ them. But what you can do is establish the kind of relationship with them where they feel comfortable letting a supervisor or someone know if they're having difficulty, so that they get help if they need it early, so that they don't go into a full relapse because of work-related stressors and things like that. In other words, treat them just as you would persons with any other disorder. There's also at times opportunities for direct investment in various projects and so on. A number of corporate entities provide support to a number of the NGOs and FBOs that provide direct and indirect mental health services, so that all of those things are helpful in terms of corporate responsibility and corporate participation in the efforts to ensure that we provide the mental health services that people need.
Thank you very much, Dr. Othello. And we go now to AZP News, please.
No, I think there was one question from Mr. Cummings.
Oh, so sorry. We had another question from Mr. Cummings.
So just related to presumed occupational risk as it relates to healthcare workers, I think from early on in the progression of COVID-19, there have been guidelines available to the healthcare workers, which we have done a lot of retraining from the ministry and from the regional health authorities. So the availability of guidelines, the availability of training, the availability of the necessary PPE, which continues to be available to our healthcare workers to ensure, based on, of course, their individual risk and their individual circumstance, the more familiar we get, the more proficient we get in terms of dealing with any new virus. Usually it redounds to a decreased risk of infection in that particular category of staff. We have seen a fairly good infection rates in terms of healthcare workers in Trinidad and Tobago. So we thankfully have continued to have an adequate supply of PPE and well-trained staff that have gone a long way to protect our staff and the persons that they care for as well.
Thank you very much, CMO. And now we go to AZP News, please.
Thank you very much. Good morning, everybody. Priya Vihari, azpnews.com. I just have one question for the CMO. CMO, there is a concern by a Dr. Karen Sohan Sinha, who has returned to Trinidad as a returning national, about social distancing practices not being adhered to and enforced in state quarantine. Is that a concern you have, or have you heard anything about it? And is there anything that can be done to solve this situation? Thank you.
Right. So there are guidelines to be followed in every quarantine facility that we have throughout the country. It's extremely difficult for us to have a team to monitor every single person and how they behave in that facility or these facilities throughout. There are guidelines there, so we informing those persons how to behave while they're there. Of course, it's more or less the same as you would in that we are advising outwards, wearing your mask if you're in close contact, washing your hands as often as possible, sterilizing your surfaces as best as you can, sanitizing, and following the guidelines as rigidly as possible. It's extremely difficult, as I said, to really get someone or a group of physicians or healthcare workers in every facility to monitor what happens with every single person at all points in time while they're in quarantine. But again, we have a process of testing at day 1 as well as day 7 in those quarantine sites to ensure that if we do pick up early positives, they are separated from the rest of the individuals. But a lot of it has to do with the personal responsibility of those coming back in. Behave as if you're carrying the virus, separate yourselves from each other. Of course, you can stay in clusters as if you have family members traveling together, but separate yourself from everyone else as best as you can, as if everyone, the person next to you, is a carrier of COVID-19. And I think we should have those persons coming out and going home to their loved ones as quickly and as safely as possible.
Thank you very much, CMO. And we go to TTT Limited, please. Sorry, Ms. Wilson, we're not hearing you. I'm not sure if there's an issue with your mic. Oh, no, it seems your mic is unmuted. Good, we're hearing you now.
Hi, Crystal Wilson, TTT Limited. Questions can be answered either by Dr. Parasram or Dr. Othello. In terms of mental health, how receptive have relatives of COVID-19 victims been in terms of accepting counseling after the loss of their loved ones, and in terms of survivors, those who were considered critical at one point? Does the Ministry of Health follow up to find out how they've been coping?
The counseling services are provided at the delivery arm of the mental health services, which is, as I indicated, through the directory, the mental health services in the regional health authorities. They have psychologists and social workers, as well as psychiatrists and other doctors and members of the mental health teams that interact with these persons and provide the care that they need. So the Ministry of Health has not been directly interacting with the patients or their relatives. So I'm not in a position to answer that question.
So can I will ask Mr. Taylor to give us Southwest Regional Health Authority perspective on that particular question. Mr. Taylor?
Yes, in response to that question, it's all needs-based. So we have had quite a good response, particularly to people that are in quarantine that are coming through the surveillance teams and those in the facilities. It's been a collaborative process with the family members and the persons who may have been positive. And like I said, it's needs-based. So once the people are feeling better and they're at a point where they don't need that intervention anymore, we would then say, if you require it again, you may come back, or we could signpost them to another service like medical social work if they have other psychosocial needs. But overall, it's been quite good.
Thank you very much, Mr. Taylor. We go now to Express newspaper.
Good morning, Kim Mudram from the Express. CMO, I would like to go to the unfortunate passing of a gentleman on the way home on a CAL flight, and to ask in this instance, the gentleman's relatives feel as if the information regarding his passing, what took place on the plane, is not forthcoming. So I would like to know how involved the Ministry of Health gets in an instance like this. Do you become directly involved with the relatives? They have questions they feel are not being answered. And sort of almost linked to that, the booking process for flights for repatriation, which we know falls under the Ministry of National Security. But again, given what happened, and it seems a large volume of people, elderly people, ill people, trying to come home, does that mean the Ministry of Health would get more involved in terms of looking at actual passenger lists, looking at the booking process, and perhaps wanting to see who is critically ill or in a situation that you may want to advise the Ministry of National Security to expedite them? Thanks. I hope that was clear.
No, I think the Ministry of Health gets involved at the stage where the exemption has already been granted in most instances. If there are persons that require medevac, meaning that you have a critically ill person that has to be brought into Trinidad by medical ambulance, we would have been alerted previously. Otherwise, persons with comorbid conditions are not the norm, but happen frequently. What we do is when they do get here, we have an ambulance on standby in the airport, and we have the necessary nurses and physicians on standby at the quarantine sites, so that if someone gets ill, we're able to deal with those individuals quickly, get them to a hospital if need be, and then, of course, assess them at secondary or tertiary care. In terms of the person that had passed away on the airplane coming to Trinidad, condolences to the family of that individual. I believe the person that aircraft had gone was very close to Puerto Rico, and because of the death on board was taken and landed in Puerto Rico at the time. We would have been aware at the Ministry of Health, because of course it was a repatriation flight and we were expecting those individuals to come in a couple nights ago to Trinidad, so we would have made preparation and had the quarantine sites at the ready together with the transfer of those individuals. So we would have been notified of the death, notified of the redirection of the flight to Puerto Rico, as well as the new date for arrival via the County Medical Officer of Health for St. George East, and he would have provided me with a report in that regard. All other details related to the patient will be sent to the relatives either via the airline rep, I believe, or through or from personal information, because I believe a relative is actually accompanying the body of that particular individual.
Okay. Thank you for the clarification, CMO. And we go now to Newsday newspaper, please.
Hi, good morning. Is everyone hearing me?
Yes, we can, Mr. Davis. Good morning.
Hi, good morning. Ryan Hamilton Davis here, Trinidad Newsday. First question I want to ask is...
Sorry, Mr. Davis. I think we're having some connectivity issue. Can you try to repeat your question? If not, we'll go to IETV and come back to you. Mr. Davis? Okay, I think...
Hello, can you hear?
Yes, let's try one more time and see if we can hear the question.
Hello?
Yes, Mr. Davis? Okay, we will sort out Newsday and let's go to IETV while we try to fix the technical issue with Newsday. IETV, please.
Hi, good morning, everyone on the panel. I have two quick questions. My first question is for the CMO. Dr. Parasram, can you give us an update as to the testing status at the San Fernando General Hospital? Over the weekend, we were told that patients waiting to join clinics as well as test for COVID-19 are being kept in the same waiting area. Can you tell us whether that's true or not? Because, like I said, someone called and told us that. And my second question is for Dr. Otello. Dr. Otello, is consideration being given for counseling services and mental health services for patients who are in state quarantine, meaning doctors could reach out to the patients instead of patients having to summon the courage to reach out to the doctors? Thank you.
Okay, just with regards to your first question, if you can send us a little more detail off air, I will relay that information to the Chief Executive Officer of Southwest Regional Health Authority so that he can provide us with an update. Yeah, Dr. Otello?
Hi, thank you for your question. And in response, since about April of this year, we have been in fact providing those services to persons in quarantine, persons who were in quarantine facilities. We have we use telemental health where that is possible, and in some cases provide psychologists and so on actually go into the facility and wear PPE when they think they need to directly interact with the person. So those services have been available for quite some time now.
Thank you very much, Dr. Otello. And we will go to TV6, please.
Hi, Vanessa Cutting, TV6 News.
Hi, good morning.
Hi, morning. On the issue of the person who would have passed on the repatriation flight, could we just have some more details as to what is taking place with the other nationals who are on the flight? And also, as much as the ministry cannot breach patient confidentiality, if COVID was indeed a factor in this incident, is the ministry giving any special consideration to treating with the returning nationals, perhaps extending their quarantine, mandatory state quarantine period or something of that sort?
Okay, so as far as I'm aware, the last information I had from the CMOH is that an autopsy would have been in the process of being performed in Puerto Rico. Of course, when we get the results of those findings, we will have a better idea of what that individual would have passed away from. And it will guide the process going forward in terms of level of exposure of those individuals. But as of now, they will continue to do for medium to high risk countries a 7-day quarantine with a test on day 1 and on day 7, as is the normal when they get into Trinidad and Tobago.
Thank you very much. I think you have another question. Please go ahead. TV6 has a second question.
Yes, it's the same question. I just wanted to get more information on the other nationals, such as when would they be returning or where they are being housed now and things like that.
Yeah, so yes, I did not get a further update on that, but I believe they were originally scheduled to return the following afternoon at 10, but I think there was an issue with the return, so I have to get some clarification from the CMOH to confirm that time.
Okay, thank you very much, CMO. And I think we will try, I think we're still having some issue with Newsday, but I think the question was sent to me, so let me see if I can raise them here. One question, with cruises coming back to the Caribbean and flights taking place in areas like Guyana, what feasible timeline can we have for the reopening of borders? And this is from Newsday. Anyone wants to take that up?
So yeah, the matter of borders is usually a matter for the Prime Minister and the Minister of National Security. I think there was some discussion in terms of the borders security, in terms of the quarantine process at the last press conference held by the Prime Minister, and I suppose there will be an update on the Saturday press conference coming forward.
Thank you. And a second question from Newsday. There was a Ministry of Health, or this is a public health release, which said there was a number of unclaimed bodies at the mortuary for one of the medical facilities. Is there any correlation between the bodies remaining there and the fear of the spread of the virus?
No, I think generally speaking, from time to time, there is an issue of a notification to the population from different RHAs, sometimes from Northwest different regional health authorities indicating that they are unclaimed bodies, which happens from time to time. It is a part of the normal practice of the mortuary system so that they can actually do some clearance in terms of the process. So it would have been it doesn't have anything to do with COVID-19 as far as I know in that particular instance.
Thank you very much. And Astronaut News, we are ready to take your questions, please.
Good morning. Are you
Good
hearing
morning.
me?
Yes, clearly. Good morning.
Right. This is William Cunningham from Astronaut Newspapers. My question is perhaps to the CMO, preferred, given the fact that the decisions taken by the Honorable Prime Minister and all the guidelines have been as a result of advice given by the medical practitioners, of which you are chief. In respect of the 1 hour for services, to the best of my recollection, it seemed the last time we had services, we did not have that restriction of 1 hour. My question is, what was the thinking of the restriction to 1 hour in the face of an increase in the number of persons? Because the last time we had a social distancing with 6 feet apart, but now we have a 50% capacity, which in my opinion would be less than the 6 feet. What is the thinking for the 1 hour?
Yeah, so you would have noted when we had lifting of the restrictions related to places of worship on the last occasion, we were in a stage of sporadic spread in terms of our designation for WHO. We are now in the stage of community spread. And as you know, it is an increased number of persons having the virus in the country. So the guidelines have to be a little more rigid to allow for decreased spread amongst those persons attending services at various times. We're trying to limit both the distance as well as the decrease in time for congregation. So it decreases the risk of spread from one person to the next. We use 50% as a benchmark just to give persons a easier sort of benchmark to follow. We were using in the past 36 square feet per individual. So it is really something that is a little bit easier for persons to follow in terms of the guideline. As I said, the guideline is just a tool that is used by individual persons so that they have a guide as to how to set up your services. But the rule of thumb is still 6 feet or thereabouts between persons, between groups.
Thank you very much, CMO. And we go to follow-up questions now. We start with CNC3 for a follow-up question.
All right, thank you again. So CMO, you mentioned in your response to my question that there have been persons who tested positive after being discharged because of viral shedding. But to your knowledge, or has it happened where someone who is shedding their viral load became symptomatic again?
Yes, so there have been at least one individual that I am aware of would have been symptom-free, gone through a hospitalization period, discharge. This was in the early phase when we actually had a double negative as a discharge criteria, and that individual developing some mild symptoms a couple of weeks later. I think it was a cough, if I remember right. We would have retested, brought them in, retested, and you had a positive, very low level of virus, but it was positive in that particular instance. So we had an instance, at least one that I am aware of someone developing symptoms again after. We had other instances where persons would have gone in, for example, to have routine surgical procedures after being positive months before, and we again picking up very low levels of the virus when we did PCR as a routine screen. So those kinds of scenarios have occurred.
Thank you, CMO. And a follow-up question from AZP News, please.
Hi, good morning again. I just want to find out from you, CMO, if there is an emergency in a public place. Now that beaches are open, sometimes a lifeguard would have to give a CPR, etc. What is the advice now if someone has a medical emergency in public and someone wants to assist? Is there certain protocols to follow? If someone needs CPR, for example, what should be done, given the issues with COVID-19 now? Thanks.
So again, there are different ways to perform CPR. Most of the lifeguards are taught and have tools that don't require one person putting their mouth on the other person's mouth. So there are devices that can actually perform breathing using those in those scenarios, which the lifeguards should have access to, so that those things, even the 811, those emergency response vehicles have access to those type of breathing apparatus, which will give you temporary breathing while you await further support. So those individual items can be sanitized. Of course, other precautions should be taken if mouth-to-mouth resuscitation is not required, as best as you can. But of course, in an emergency situation, we are trying to save life. So someone's is putting someone else's personal well-being ahead of yourself for a short period of time. And we hope in those instances, persons are not dissuaded from doing so because of COVID-19.
Thank you. And a follow-up question from Express, please.
Good morning. Thanks again. Kim Woodram again. CMO, maybe a little bit of an odd question, but one I've gotten several times, so I decided to ask. So someone asked, they were speaking with a person, and the person sneezed. And in one instance, the person, probably unwittingly, out of habit, pulled their mask off to sneeze. And then in another instance, they sneezed and the mask flew. And so the person who was sneezed upon, several people actually, want to know, especially if they felt that they were the recipient of any sort of extrusion there, what to do. Because what happened afterwards is that there was a person close to tears and paranoia because they suffer from sinus issues. And so a week later, this person was convinced they may have COVID. Now, because it happens so often, I know it's a bit of an odd and silly question, but people really want to know, if someone sneezes on me, what should I do immediately after? And for instance, if I get a little bit sniffly 4 days later, should I do the responsible thing and go for a COVID test? There are just all of these little things happening in between in this pandemic that, require some answers. Thank you.
So I suppose, first of all, I think you shouldn't be close enough to someone else to be the recipient of a sneeze. And if you are close enough to someone for that person to sneeze on you, you should be wearing your mask, and they should be wearing their mask as well. So I think if everybody follows the guidelines, generally speaking, we decrease the risk significantly. If both persons are wearing their masks, there's some research that suggests there's a decrease of 90% of spreading a virus from one individual to the next. So really wearing your mask, following the guidelines as best as you can, is what we're trying to achieve, decreasing the risk of passing the virus from one individual to the next. If you have an unfortunate circumstance where you weren't wearing your mask and that would have happened again, in a scenario where we have community spread and you find that you have symptoms coming up within the incubation period, which is 14 days, we advise that you do get tested at this point, so that we see if you do have COVID-19 or some other virus occurring. Just an update before, Candice. So the CMH for St. George's, I think someone would have asked when would those individuals be coming in. They did come in, I believe, shortly after midnight last night. I believe it's TV6, those individuals from the flight. He just gave me an update saying they came in after midnight last night.
Oh, wonderful. Thank you, CMO. And some great news for some of our nationals there. And of course, condolences to the family of the gentleman that passed. And we have a final follow-up question from Newsday. Again, thanks to technology. And the question is centered around super spreader events in Trinidad and Tobago. And how does that affect some of the recommendations? And it's directed to CMO. How does it affect the recommendations that go up the line to the leadership team as it relates to opening of certain types of facilities and closing other types? Have we had that experience, and what impact does it have on your advice?
So any facility or any type of behavior that will allow for congregation of a large number of people without allowing for social distance and without allowing for mass poses the risk of having a super spreader event occurring in that particular area, especially if people go into those sorts of areas when they are ill. So our recommendations at a base in terms of public health guidelines would be guided by not having places open where persons can't wear a mask as well as can't social distance at the same time. So if you look at our recommendations so far, you would see that those basic premises are what we are trying to achieve.
Thank you very much, CMO. And we have come to the end of today's press conference. I know that the journey has been long and we have a long way to go, but please let us encourage each other along the road to a safe and healthy Trinidad and Tobago. Remember that mental health services are available through all our RHAs. You can go to our website, the Ministry of Health's website, our social media pages, or the website and social media pages of all the regional health authorities. There are 3 very simple things that you can do. 1, ask yourself and ask your loved ones, how are you doing today? Get your flu shot, and remember, wear your mask above your nose and mouth. Have a great day, everyone.
COVID-19 is here and has become everyone's business. It's not a respecter of age, race, gender,